right, it is 10 o'clock. I'd like to call the April 8th Jackson County Human Services Committee meeting to order. First up, we're looking for an approval of the agenda. Moved by Commissioner Palachuk, supported by Commissioner Leitner. I would like to ask all of you to please use your lights at this time to prove that we are highly skilled and technically advantaged commissioners. All right, Adam, on our screen.
How did it pop up?
Unanimously approved? No, it did not pop up on mine, but it did. Yes, just on my, but I see it up there, so I believe we're okay to move on then. All right, up next we have the minutes of the March 11th, 2013 Human Services Committee meeting.
Support.
Oh, I'm so sorry. We have, okay, that's fine. We have a motion by Commissioner Palachuk, and I heard support by Commissioner Rice. All in favor, please say aye.
Aye.
All opposed? I do like to back up a little bit and move to number 3, to public comment. Now that we have an agenda and we have acknowledged our minutes from last meeting, are there any public members that would like to speak to the board? Seeing none, we'll move on to committee items. B, the Region 2 Area Agency on Aging, the biannual report. Is there anyone to report? We do have in our packets, their report has been submitted and can be found online. I believe now we will move on to committee item C, Lifeways. Gerard?
Good morning. My name is Gerard Saraki. I'm the Finance Director at Lifeways, and Mary Beth Caldwell is away at conference and asked that I be here to answer any questions anyone may have. I'll kind of briefly go over the report. Hopefully you've all had an opportunity to read it. I'll just kind of give you some updates with respect to some of the things going on in the report. One of the things we've been doing is drilling down on the proposal for the both counties' maintenance, Jackson and Hillsdale County. So when Mary Beth gets back from the conference, we plan on sitting down and possibly finalizing that. So we'll probably be getting with Mike and Adam. With respect to Hillsdale County, I think you all know we have a building down there plus our group homes. Currently, the Hillsdale Facilities Department does work at some light housekeeping work at the building. We're pursuing the opportunities of having them do more of the higher level maintenance type projects. With respect to the provider contracts, we have our legal counsel looking at the legality of those, so hopefully in the near future we'll have some resolution on those. Tenant leases, again, as stated in the memo, as they become due, we have increased the lease rent. In terms of a little more update, we did have one of the office tenants increase their space by about 120 square feet. Isn't much, but it does consume some of that vacant space that we have out there. Also, we have the 8,000 plus square feet of retail space, which we have recently been told by the city of Jackson that they have exempted that from property taxes, which is a really nice enhancement for us, at least for this year. That will save Lifeways approximately $14,000 to $15,000 a year. In addition to that, we have a couple things going on. We have an LOI, which is an acronym for Letter of Intent. We have a major retailer who will be meeting, I believe, April 10th to determine if they want that space or not. So hopefully we'll have some good news with respect to that vacant space. Additionally, we do have a temporary tenant coming in, again, we think, Spirit Halloween. They were there last year, and they want to come back, so that's very positive. We're still gathering information with respect to the Transit Authority strategy. Mary Beth has provided a state update. I'll try to answer any questions with respect to that. It is moving along, it is on a fast track, and it's going to happen. July 1st, we have to have articles of incorporation or interlocal governmental agreements in place. It is expected to start January 1st, 2014. Also, Mary Beth has included some information on Medicaid expansion. There's a website. She had asked that you go to the website, and if you support it, please let your local legislators know that. So that concludes my report. I'll try to field any questions you may have.
Commissioners, any comments, questions, discussion? Commissioner Shotwell?
I don't know if you can answer this, Gerard, but under your state update, the Medicaid expansion advocacy needed, is there a thought process behind how that will be done here in Jackson County yet to reach those people other than just going to the website to look at it?
Well, we as an organization have certainly been promoting the fact that we would like to see the Medicaid expansion happen. We do know that it's stalled right now in legislation. I'm not sure if it's a completely dead deal at this point, but my understanding is there's still hope. So if you have questions, again, there's if you go to our Lifeways website, there is some brief explanation of what the Medicaid expansion can do, and there is a cost to the state. We understand that, but we believe the benefit far outweighs the cost.
Commissioner Mahoney?
Thank you, Madam Chair. Chairman Shotwell, I think in relation to what you were directly saying, yes, she has met with each one of our state and local legislators in Jackson and in Hillsdale, as well as our congresspeople representative on a one-on-one basis to express the need and exactly what would happen with those dollars if it does expand. As you know, right now, the need for Medicaid dollars is great. We're having to use general fund dollars because we can't turn people away, and there is a greater number of people that are coming in for service than the dollars that we received. So that's why we're so anxious to have those Medicaid dollars expanded, because of the greater need that we have in the community. George's not political, so he doesn't know what you were asking, so I just thought I would clarify that for you.
Just to add on, if I may, Gail has said that once we start dipping in the general fund dollars, those are, again, appropriations from the state, but when we exceed the general fund dollars, those are supposed to come from local funding sources. We're currently, based upon year-to-date activity within the financials, we're currently projecting overspending our general fund due to various reasons. So the Medicaid expansion would help offset some of that. That is certainly one of the benefits that Lifeways, Jackson and Hillsdale counties could accrue.
Hi, Gerard.
Hey,
And it's a pleasure working with you on Lifeways, by the way.
thank you, and welcome to the board.
You guys sure work us. Anyway, not to put you on the spot, but I've heard this before, and I just heard you mention it. If you're saying if Medicaid expansion does not occur, and there's a lot of talk out there that it won't. Now, again, you're correct, it's not dead, but certainly the talk is that it won't be expanded. I do know that that there is some possibility of some type of other legislation being put forth to potentially sort of meet halfway in this whole thing to provide dollars. But based on what you just said, if it doesn't go through and Lifeways goes over its general fund, which sounds like it's going to, that you would have to come back to the local units, that would be Jackson County and Hillsdale County, in regards to increasing the local match that we have already provided you. Is that correct?
What I said is, if we overspend general fund, those costs are made up through local fund sources. Potentially, we would have to get it from somewhere, it's correct. And again, that is, understand this is a projection. One of the biggest driver is the state inpatient cost, which is just skyrocketed in the last several years. And we are working on strategies to bring those down.
Thank you.
Any other comments, questions? Thank you, Gerard.
Thank you.
Up next on the agenda, 4D, the Health Department, your monthly report. Mr. Hall?
Good morning. Well, you have my report. I won't read it to you. The one thing I did want to kind of expand upon a little bit was the county health rankings. And I did want to point out that we improved from 2012, where we were 53rd out of the 82 counties that were ranked in the state, and this year we rank at 48. A couple of the areas that I wanted to point out that are issues for Jackson County. Adult smoking, our percentage was 23 when the state of Michigan's percentage was 20, and the national benchmark is 13%. Adult obesity, our percentage was 37%. The state average is 32, and the national benchmark at 25. Physical inactivity, we were 28%. The state average 25. The national benchmark at 21%. And one that's somewhat alarming, both for Jackson County and the state, when you look at what the national benchmark is excessive drinking. We were at 21%. The state is at 19%, when the national benchmark is at 7%. So definitely some areas where we can improve, but overall, again, we saw an improvement from the prior year. So that was basically what I wanted to cover today, unless you have any questions.
Commissioner Polacek?
That's a good question. Right, it's, if you go on and I included the website in my report, if you go on there, you click on the different parameters and it'll explain where they come up with the numbers. I know amongst health officers there's always some questioning of where some of these numbers do come up from. It's a University of Wisconsin project that they do every year with the Robert Wood Johnson Foundation, and each parameter is different as as to where they get those numbers from, but if you can click on the individual parameters, and then it'll show you right on the website. And if you have any questions on specific ones, feel free to email me, and I can get that info to you.
Any other comments or questions for Mr. Hall? And John, I can call and check in on, 3-a-day dairy products is what we need, so I can, monitor that for you if you'd like. All right, thank you. Up next on the agenda, number 4, letter E, and that's the Health Department, initiation of fees for the walk-in STD clinic and service. First of all, we do appreciate you joining us at the study session again last Friday to revisit this topic.
Well, we appreciate the opportunity to join you. And based on the study session, we would ask that our recommendation be changed to indicate that the motion be to move to the full board a revision of the Jackson County Health Department fee schedule to add a $10 fee for Jackson County residents, and that non-residents would pay cost.
All right, well, that definitely seemed to be the consensus last Friday at the study session as well in regards to the direction the commissioners were going. With that, commissioners? Mhm.
Support.
Okay, so the motion was made by Commissioner Mahoney, supported by Commissioner Leitner, for in-county residents, the fee of $10, and non-county residents, the actual cost of services. Is that correct? Please use your lights, commissioners. It was unanimously passed to send this issue to the full board. Commissioners, any conversations, discussion, information you'd like to share?
Thank you. I don't know if this is a question for Mary or not, but I know that currently you cannot charge any insurances because you don't have a physician or a physician's assistant on staff, and it would be cost prohibitive to do that. Can you do that once we have Dr. Schultz on board? Can we do that as a standing order and then have, no? Doctors can call in standing orders, that's why I'm...
Right, the nurse-run clinic is run under standing orders from our medical director currently. The only way that you could bill, and Mary can correct me if I'm wrong, but the only way that we would be able to bill would be as if that doctor was actually in the clinic and provided the services.
Okay, I'm just thinking back of my own nursing days where a doctor could call in an order, you would perform that service in the hospital, it would be billed for. The service would be billed for, and the doctor would come in later and sign the chart. And I'm just wondering if that is not a procedure that could be followed there, or could we look into that at least?
We do have standing orders that Dr. Laurenchuk signs every year, but in order to actually bill private insurances, you have to have a practitioner in the clinic.
Okay, so if Dr. Schultz showed up periodically, on a regular basis, say weekly, and signed off on all of the tests that were done, could you not charge for those?
We could definitely check into that. It would be a huge burden on our billing department because we don't bill any private insurances other than Medicare and Medicaid, but we could certainly look into that.
I'm just hoping that that would offset some costs and that there's actually money to be made and not lost by looking into it.
She would most likely have to actually work be present in the clinic, and what I would have to check out with Medicaid is if she would have to actually do some of the testing, or if she could just sign off on it.
It's just a thought.
Right. Commissioner Rice and then Commissioner Mahoney?
In regards to the same conversation here that Commissioner Polaczyk presented, I had an email with Steve regarding this particular matter, and there is a possibility that once we have a health care director in place, that there potentially could be a pun on words, an allegiance to potentially maybe work with them to have a nurse practitioner or physician that could provide these services, and potentially even have set up hours that could take place. Now, that certainly would be a viable option potentially, correct?
Correct.
Another thing I have here is, as long as the recommendation here has gone to the full board, and obviously there's some changes here, is there a way that, and I would leave this up to you two to discuss and explore the possibility of, and I certainly would respect your view on it, but is there a way to let the public know that if you have Medicaid, Medicare, or if you have insurance coverage, that you highly recommend that they seek health care services from facilities that accept their insurance? I mean, again, from my perspective, what would it hurt to at least put that out there and say, you know, we are here to help people who don't have insurance, or they're underinsured, so their insurance won't cover this, and yet we're paying for people that could actually be covered by insurance. I mean, isn't there a way that you could put that out there as well and say, listen, this is why we're here, and if you have insurance, any healthcare facility will accept you. They will be confidential, et cetera, et cetera, et cetera. I mean, just throwing that out there.
We could certainly try to get that message out. In fact, that is not, it's not a new message really, because even in our immunization program, the goal is to have clients go to their medical home. I think the difference between immunizations and STD is, first of all, the ease of access. And I meant no disrespect to the Center for Family Health at the study session on Friday, but I have personal experience. We have clients that say they cannot get into the center, and I have a friend whose sister has tried to get into the Center for Family Health since November and has not been able to get an appointment. You cannot just walk in and be tested and treated for an STD there, and that's a huge issue with our clients. Of course, we would rather they go to their medical home. A lot of our clients don't even have private providers. And then the whole confidentiality, anonymity issue is huge. And we want to respect that. But we can certainly get that word out that if they do have private insurance or Medicaid, they go to a private provider. But we can't force them to do that either.
I understand you can't force them, but I just would like to see it strongly put out there. Commissioner Polaczyk could answer this better than myself, but I certainly know that Allegiance would take people in. They certainly would love to accept the insurance and provide the testing. I have no doubt about that.
I'm sure that they would, Carl, and we do have clients that routinely go to the emergency room for STD testing and treatment, but I don't believe that's a proper use of the emergency room. And, I mean, that only drives up healthcare costs ultimately. So we're trying to keep them out of the emergency room.
Commissioner Mahoney?
Thank you, Madam Chair. Just to piggyback off what Mary said, it is true. Unfortunately, I used to sit on the board for the Center for Family Health, and even with the large facility that they have, there is still such a great need that they do not, the process is, you call in every morning to see if you can get an appointment. And you start calling at 8 o'clock. The line is busy until 8:30, and by the time you actually get through, at like, say 8:35, all the appointments for the day are filled. They don't just give out appointments and say your appointment is on November the 5th, or, they don't even appoint out. You have to call in every single day to try and get an appointment. They're so over the need that you can't get in. And it's unfortunate, but it's the truth. And I think passing this fee as it is, and the fact that people don't have to pay, we're not going to see a whole lot of change. Unfortunately, I don't think so.
I don't want to belabor this, and I don't disagree with the demand and the struggles people have getting into, for instance, Center for Family Health. But again, we have walk-in clinics. A person can drive down the road, and a doctor's office can be accepting new patients, and they can go into that office, use their insurance, and get their testing. What I'm trying to say here is we have Jackson County residents who are paying for this type of service, their tax dollars, and the fact is they're paying for it even though people have insurance that could cover it. So again, it's like being double dipped, because the Jackson County taxpayers are also footing in the bill for the Medicaid or Medicare. So again, I just think we need to get a strong message out there. There is other options besides just coming here. And I just would like for you to certainly explore that for me.
Thank you, Commissioner Rice. In addition, is our board is aware, to make a matter of record, there are several commissioners, some who are not here, who have additional questions, and we have asked our administrator's office to send them to you. Some of those questions basically have to do with what the law is, and actual documentation is being requested so that we know what exactly our requirements are, and that would entail what our obligation is, our legal obligation is, to provide that service for in-county residents as well as out-of-county residents. The question has also been asked, and at some point in time, we would like an answer from your department, please. Again, not now, but at some point in time, what is the requirement in regard to a picture governmental ID? If we're making that separation between an in-county resident and that fee, and the out-of-county resident and the additional fees, do we have that, are we empowered to require an ID, and what would we do in the case of an individual showed up for testing and did not have that government ID? So, Commissioner Rice, I think that is what you were mentioning also, to make sure that all of our questions are addressed. But for now, at this point, we have the motion, again, $10 for in-county resident fee and an actual cost of service for out-of-county. That has been unanimously approved and will go to the full board. Are there any other board members' questions or comments? Commissioner Leitner? All right, thank you. Thank you again for your time and service. Up next on the, they're giggling down there. I just want to make sure she didn't fall asleep down there. Up next on the agenda, we have the Health Department Animal Shelter Quarterly Report.
Okay, you've received my report. A couple of things I did want to expand on. Number one, I wanted to talk a little bit about our numbers, and I really wanted to kind of drive home the point that the surgery suite, we're really starting to see the difference and what it was intended to be. If you look back, the surgery suite went into use in July of 2010. And I looked back, our 2009 numbers, we had took in 2,376 dogs, 3,156 cats. And if you look at the 2012 numbers, which I just submitted to the state, that we had 1,449 dogs and 2,102 cats. So since 2009, that was at 927 less dogs and 1,054 less cats. And our adoption numbers have pretty much remained the same, so that's really a good statistic and a good way to look at it, to see what that impact of actually making sure all the animals are sterilized before they leave the shelter. The other thing that I wanted to touch on was I have Christina here with me. I wanted to introduce her to the board. She is a board member of Friends of the Animals for the Jackson Area, Inc., and they have just been a great help to the animal shelter in the last year and a half or so, I'd say. If you'll recall, they paid for all of our puppy room improvements, which totaled about $8,500. They have provided medication so that we could treat heartworm-positive dogs. They sponsored the Pets for Vets initiative that we had, where veterans were able to get animals for free, and they paid for the adoption costs for that. And they also paid for the live radio broadcast that we had as part of our open house. So I estimate that they've probably, between the animal shelter and Dr. Anderson's rescue, have provided about $15,000 in the last year and a half to the animal shelter. And we greatly appreciate it, and they're continuing to help us. And so I just wanted you to actually meet Christina and a board member. And
I feel like I'm the good news girl. I'm not asking for money. I'm giving it. Thank you. Obviously, we are a group of big-time animal lovers. We had a meeting last night, and this isn't our big, quote, giveaway, but we have approved another $2,000 for PAWS to continue with the heartworm and upper respiratory issues, which, as you know, have been running rampant in the county. And we also have made an approval to buy a $900 and some vacuum. That is what you really needed, especially for the puppy room, which of course is very near and dear to our hearts. And we are hoping this will be a long, continuing friendship between us and the shelter. We do other charities as well, but we love the animals, and the more we can help them, the less that are euthanized, we're all for it. And we thank you for letting us come and meet you, so you know who we are. I'm just one of our board. We happen to be all women right now. We have had men, but we know how to make money. And we'd love to invite you to, we have a bowling event coming up this month. We have a wine tasting out at Sand Hill Crane. Check out our website and come join us.
Thank you, and thank you, Christina, and your organization, all you do for Jackson County as well. Commissioners, comments? Commissioner Shotwell?
Steve,
yes.
We have an animal I want to walk through a scenario and you tell me how we handle the scenario at this time. We have an animal that get hit by a car and it's dead at the scene. Who then handles the retrieval of that body and delivery to you, and is for lack of a better term, I know, necropsy done on the animal to see if it had rabies or anything like that?
If an animal was just hit by a car,
I'm using a stray dog.
right. As far as being tested for rabies, no, unless there was some indication that it had bit someone.
Okay.
If we had that, then yes, it would be tested. As far as transportation, sometimes we receive animals like that from the public, sometimes animal control will bring them in.
Is there any requirement that we pick them up and bring them
No,
into the shelter for disposal?
no.
Okay.
I just want to say it's good to see that Sugar's healthy and has a home.
Yep. Well, that was a neat story. I think Lisa's back here. There may even be a follow-up story to that, so.
All right. Thank you. Any other comments or questions for Steve? All right, thank you, Steve.
Thanks.
Next up on the agenda, 4G, we have the medical care facility. Attached in your board packet is the monthly report with the financials. Seeing no one here from the medical care facility, I guess we will now move on to 4H, Department on Aging, their monthly report. Hello, Marcy.
Okay, good morning. You have an electronic copy of our 2012 annual report, and as it mentions, this is the first year that we're reporting information on the calendar year. In the past, we did the grant year for, as far as our statistics, which is October through September, but we're now able to pull our statistics based on the county budget year, so it's for the calendar year. And I have some other information I wanted to go over with you. First, I'll pull out a couple pieces that are in the annual report with regard to the budget. And I want to talk about some service prioritization our department has recently worked on with employee groups and the Advisory Council on Aging. And look at, specifically at home care services and some things that we noticed that happened in 2012. So this is just the cover sheet of the annual report that you received a copy. And within the report, there's two pie charts. There's one that show the budgets. And just to point out that almost 2/3 of the budgets are related to in-home services, lighthouse cleaning, bathing assistance, respite, and Meals on Wheels. And then our revenue, of course, senior millage is our biggest piece of the pie, and then grants is second. That's grants through the Region 2 Area Agency on Aging, and that includes USDA per meal reimbursement for each Meal on Wheel and senior nutrition meal that we provide. And then the other revenue sources are listed. And with regard to priorities, there's the Board of Commissioner priorities. And as I explained last month, Department on Aging Services fit with the healthy community priority because we want people to be active, help them maintain their health, both mental health-wise, socialization, and helping support services in their home so they can stay living independently as long as possible. And then the additional priority this year, community and social supports, that you could relate our services with that priority as well. So as a Department on Aging, what has happened recently is last fall we had a department-wide high-performance organization retreat where we talked about the concept of what a high-performance organization is, the theme of how do we go from good services to great services. And as a result of that training, then the employees chose 4 different focus groups that now they are meeting every month to discuss these different topics, increasing public awareness about our services, developing resources to support our services, looking at whether we can enhance client services, and then improving our method for getting employee input regarding their new ideas. So through the high-performance organization teams, and then we did a survey of our employees and the Advisory Council on Aging. What it was an alphabetical list of all our services. We listed 20 of them, and then people listed from 1 to 20 what was their priority. And the top 5, the top one was Meals on Wheels. We all know the importance of proper nutrition that helps with health. And then the next 3 or 4 were related to home care services. We broke it down because there's personal care, bathing assistance. Many of our seniors only want the homemaker service, which is lighthouse cleaning every other week. Then there's in-home services where a worker goes in and stays with someone who needs 24-hour care so that the caregiver can leave for 4 to 6 hours. And then errands, grocery shopping especially. So what I wanted to show are units of service since senior millage. So the bar in the gold on the left, that's pre-senior millage. And then the other 3 bars are the last 3 years. So just to show how senior millage has helped us provide more hours of service to the community. And what I want to point out is how it went down. Our home care services went down in 2012. And we're quite concerned about that. The High Performance Organization Group, employee group talked about it, staff have talked about it for the year, we've tried, what can we do? And this will go to Personnel and Finance, but I report to Human Services Committee, so I wanted to let you know. Well, that's the task group that's looked at this. We're concerned about the research that the task force did and that I've looked at. What home care workers are telling us when they start employment with us, they come qualified, they're good workers, but when they find a job that has more hours than the 18 and a half that are allowed as a casual position, then they leave and go work elsewhere. So we have 8 part-time positions right now. That's the 8, we had 4 originally, 4 more were added after senior millage. We see that we need 3 more part-time positions so that we can have schedule workers more hours, and then with the intent of lowering the turnover rate, because the turnover rate affects how we can assign clients, how quickly we can do that. So are there any questions about?
Commissioner Mahoney?
Thank you, Madam Chair. Marcy, wouldn't that also help the seniors? I know that, meet a new face all the time is difficult for them. And so, with the turnover rate, to have a different person go out and refamiliarize themselves with their home and what their needs are. And I certainly support that we have more people that would be able to be consistent. So to increase the hours so that we can have specifically consistent people, I would certainly, be in favor of moving in that direction.
And I've looked at the budget, and if it's approved, there is a budget adjustment to shift money from casual time to part-time. In talking with the staff who do the scheduling, they're telling me that they still want to continue having casual workers. Don't make the shift entirely to part-time. The casual gives more flexibility, especially with filling, if a client has to cancel or change their appointment so their regular worker can't go, it's helpful to have a casual worker that could fill in another time in the week. But also, sometimes we hire a worker on the out edge of the county, and they may have 2 or 3 clients, and that's all. But it's clients in the outer part of the county that we want to reach. So we still like that flexibility with the casual, but we're looking at consistency of workers if we could have 3 more part-time.
Thank you. Commissioner Rice?
Hi, Marcy. This will probably be brought up at Personnel and Finance, but how many casual workers do you currently have?
We have about 20 casual workers right now.
So are you saying that you're going to, obviously you want to keep casual workers like you just said, but are you going to decrease the amount of casual workers to add 3 part-time? Is that what you're saying?
Correct.
Okay, thank you.
Through attrition, yeah.
Okay, thank you.
Any comments or questions for Marcy? All right, Marcy, thank you for that report.
One last
Yes,
thing.
Sure.
I have another thing. I have a thank you note from a Meals on Wheels senior. I wanted to read part of it. I live alone with 0 family and no longer can cook for myself. I depend on the meals, and they are good and fill me up. Plus, the fresh fruit is a treat that I normally wouldn't buy at the store, as I hardly can go shopping, so your meals are usually my only meal of the day. And I think she gets the hot meal and then the cold meal for supper. And just a reminder, there's a Financial Scams 101 seminar on April 23rd, and I'll leave some flyers by the door in case somebody wants to pick some up. And this is through the prosecutor's office and the sheriff.
All right, thank you.
Thank you.
All right, next on the agenda, letter I, the Jackson County Medical Care Facility, a property purchase. The recommended action is to assume ownership of the Jackson County Medical Care Facility purchased properties at 401 West Trail Street and 424 West Trail Street, and authorize legal counsel to amend the lease between Jackson County and the Jackson County Medical Care Facility to include these two properties. Conversation? Minutes, no, nothing to report. Commissioner Rice.
I move to accept the Administrator Controller's recommendation.
And send it to the full board.
Thank you, yes.
Motion made by Commissioner Rice, seconded by Commissioner Mahoney. Please use your lights at this time to vote. That unanimously passed, and will go to the full board. Yes, Commissioner Rice?
Well, since there's nobody here from the medical care facility to ask, I'll ask our administrators. In this transaction, if this goes through the full board, the money that the medical care facility spent for these properties, the $1,000 plus, are we going to have to turn around and reimburse them since we're going to take over the properties?
It's not my intent.
I'm glad to hear that.
Thank you. Now, under other business, we have claims.
Support.
Commissioner Mahoney, supported by Commissioner Rice, are supporting the claims to be paid. All in favor, say aye. All opposed? Thank you. Next, under other business, we have minutes of other meetings. And you will find the DHS board meeting minutes as well as the Veterans Affairs meeting minutes attached there. Reporting schedule for May. Medical Examiner, Department on Aging, Health Department, Lifeways, and I believe Community Action Agency will be reporting to us as well in May. Public comment. Is there anyone that would like to make a comment? Committee member comments. Seeing none, I move to adjourn at 10:48.